The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hi, and welcome to the People's View for Tuesday, June 23rd, 2020. My name is Bill Ohm. I'll be your host today on the People's View. With me is my friend and colleague, Carl Seidel. Welcome, Carl.
Hi, thanks, Bill. Nice to see you again.
Good to have you with us. So we'd like to talk about the news that affects the folks here in Nashua and then offer some commentary on the news. So most of the news these days has been about the coronavirus, how it's affecting people and business. And I thought it might be useful, now that we're almost 5 months into the beginning of the virus situation and a couple months into the peak of it, to talk a little bit about what caused the shutdown in the state and where do we stand relative to that shutdown. So I think when the virus first came over from Wuhan province in China, there was a lot of concern that this was going to be something extremely serious and widespread, very contagious, and with a high morbidity rate, that is, people getting pretty sick, and also high mortality rate. So the government took, I think, appropriate precautions starting in March to begin to shut down much of the economy to protect folks from being overly exposed to the virus. And as we've seen, that was quite painful for many of us to have the businesses and the shops and the restaurants shut down, but we felt there was a need for it. And there was hospital ships brought to New York and California. I was involved with setting up hospital tents outside medical facilities in case we were overflowed with virus victims. And the concern, of course, was that it would be a very severe case, and there'd be a number of very severe cases, and that would then require hospitalization, and there was capacity concerns that maybe too many people had to be treated at the same time, and that would just cause all kinds of terrible problems. So everybody reacted quite appropriately to set up capacity. But now here we are into the end of June, and what's happened? Well, I thought there's some pretty good stats that I wanted to show you. This is from the website, the government's website, and there's a New Hampshire section on this which shows the effect of the virus in New Hampshire. And this graph shows the number of new cases over time. So you see it started out pretty slow at the beginning of the year. The peak was, around March, April. And lately it's been dropping off pretty dramatically as people have maintained social distances. People have been more careful with the personal hygiene, washing your hands and so on. And now we're kind of at the bottom of the curve here. And then the question is, what's appropriate going forward? Well, that kind of comes down to who's the vulnerable population. When the virus first hit, it wasn't clear whether this would hit everybody in the same age groups equally, or whether it's going to be restricted to certain groups. It's going to hit the kids harder than the old folks. We didn't know. But it turns out we do now know, and the data is pretty dramatic on the age issue on the population. The chart I have here shows some data on the population, and basically it says that about 85% of the cases, confirmed cases with symptoms, are in the group that is over 70 years old. And
I think that was very important.
Go ahead, Carl.
That's something that they didn't understand. How
yeah,
much
we didn't know that. So kind of the guidelines in summary say the following, that, vulnerable individuals who needs to be protected from this current situation. And it's two groups: people with underlying conditions and people who are basically over 60 and really over 70 that need to be protected, because the rest of the population seems to, although they may get sick, they don't get seriously sick. And indeed, the death rates are extremely low for anybody under 60, almost non-existent. So that brings us to what makes sense here, Carl. What do we think we should do? So we keep the economy shut down, so we bring it back in stages? What's your thoughts?
Well, I think that they have to go through all this a little bit more thought. How do you define where people pick this up? Are they contaminating people that were living close in assisted living quarters? Yes, they were contaminating one another, and I don't think many of them had the proper equipment reserved for the emergency treatment that was happening. Those are the people that passed away quickly because of breathing problems, basically, or some kind of pneumonia that caused them to fail. And I think that's number one. But the other thing is, too, they're trying to find out if people, once they have it, whether they can track it down to somebody who passed it on to them by going back and seeing who they had contacted in the previous 2 weeks. They're going to learn a lot from that. I hope they learn a lot, but they have to really define where people were picking this up. Were they getting it by some kind of passage or contact with the person, or is it something that could be contaminated and they happen to touch it, type of thing?
Yeah, there is some data on that, Carl, and the latest data is that the touching of surfaces seems to be a pretty unlikely vector for transmission of the disease. And even though it's always good to keep things clean, it seems to be, kind of in the noise level of the risk of contagion. The biggest factor is the sneezing, the speaking. It's kind of the common sense that if you're sneezing, you've got a cold, you're going to pass it along. And so people who have a cold really need to wear the mask, as we see in Japan and other parts of Asia, where traditionally they've covered their faces up with any kind of a bug. The other factor you talked about is clustering. And indeed, the data shows this is a chart on the cluster associated groups. And it basically says that by far and away, the biggest contagion issue is within clusters. And that, of course, is the nursing homes, in the our own nursing home in Hillsborough County, which is the biggest factor in Hillsborough County of clusters, and also the assisted living and other nursing places that are private as being a problem. And indeed, I think some of the reporting indicated that they had some of the workers come in who tested positive, and the workers, of course, have very intensive interaction with the patients who are mobility impaired, and it's very tough to avoid any transmission under those conditions. So I think they've been pretty much bursting out of the nursing homes, and they've restricted relatives from coming in, but they still have to have the staff.
Well, it's going to be interesting in seeing as they let groups get together now. They're gradually making them larger and larger to see whether healthy people like that do pass something on, because there are a lot of people that had the virus but didn't show any signs of it, and you don't know whether it's going to be very interesting to see how groups of people who may have very few elderly people who are more sensitive to to being contaminated are being affected by larger groups. I think that's people just wearing a mask, I think, can get along fairly well.
Yeah, I think that's pretty clear, Carl. I think a responsible person who is going to come in contact with an elderly person really has a duty now to wear the mask. You may be asymptomatic. In fact, the data shows that about 85% of the people who have contracted the virus don't know it.
Mm-hmm.
They're asymptomatic, but they still carry it for maybe 2 weeks, and then it's purged from their system. They've got the immunity built up. They've knocked out the bug, and it's not being spread by them anymore. But during that window of unknown vulnerability, when they don't know whether they have it or not, they interact with our seniors, you and I, and other folks that, it's a problem. But then that leads to the other question. Well, what if you're not going to interact with the seniors? Is it okay to just be normal among your peers?
Mm-hmm.
I would think that's a logical conclusion from the data.
Well, yeah, I think so too. I think the other area you have to look at too is the people who are the medical people who are treating these patients and how well they were able to resist getting contaminated, whether it was what they did or what they didn't do, or see if there varies like it did between some of the assisted living places. Some were very much prepared for it. Others were very weakly prepared for it. And it's the percentage who had problems and essentially passed away were higher in some places, that much higher than in other places. So
yeah, and I think of the Hillsborough County Nursing Home, Carl. You were the chair of the Nashua delegation back in the day, and the delegation had a lot of influence over Hillsborough County and the budget for it and the nursing home. And I thought we had very dedicated people there, but they were somewhat underpaid. It was tough to retain them. They didn't have a lot of resource to have backup plans in place. What's your take on that Hillsborough County situation?
I wasn't there this year, but when I was there, they were very, very well prepared. They had people in certain cases that were underpaid, but that was somewhat had to do with some of the Medicare costs or Medicaid costs that were covering their costs of service there. I don't know. I don't have the data for what happened during this virus, how well they handled that. But I thought we had a very good one, better than a lot of the commercial systems that were out there.
Yeah, and these nursing homes, there's degrees of expenditures required. If you are well off, you can go to a very resort-like home and get first-class treatment. And the other end is if you're indigent and on Medicaid, now you really have to get on the wait list for the county nursing home to be given care in a more intensive environment that you might just get at home with home care.
But I was impressed with the amount of service they were able to give on a very economical budget.
Yeah. Well, we've had good people. I was always impressed by the people I met at the nursing home. Very dedicated folks, and
yes.
I'm glad that things have improved somewhat. In the early 2010s when you and I were involved, and got them in a little better footing, particularly with the Medicaid reimbursement problems with the state and some of the financial games that were played. But we should talk a bit about some of the financial issues now, Carl, because with Nashua being shut down, with businesses at risk, we've got restaurants who are closed. I'm sure they're not all going to come back. Restaurants are a thin margin business. When you do come back, you'd like to have your beverage service open because, let's face it, if you food and beverage, your beverage is really what's making the money for the business. The food's kind of a break even. And you like to have a social item. You like to have, a lively pub and have people socializing and having a good time. And we can't do that. Even now, I look at the latest elimination of some of the pretty severe restrictions we've had. And according to the current deputy health director in New Hampshire, she says it's very important and she will strictly enforce this 6-foot social distancing in public establishments like restaurants. Well, you can't have a bar and have everybody 6 feet apart and you mingle, you interact, you socialize. How the risk of a rebound?
If you haven't been out, I went out to my first one yesterday, for somebody's birthday. and they had more plastic separating people and keeping them, because they are somewhat close, but then they have a plastic sheet separating the booths, or plastic drapes, like an operating room or something, where you have plastic separating certain areas. They get around it, and I see people going back. It is different. The waitress said, yes, it is different, but I'll tell you what, the service was faster. They delivered. I wasn't even ready to have the food there, and it was there. So they like to just have a minimum contact with you. And so they serve you faster. At least that was my impression right away. And it looked like it was very safe. There were people that are getting used to that. And of course, you see downtown Nashua now with half the streets being half a street because they're eating on the street.
Yeah, we're all become street people, I guess, Carl.
So it's hard, but people are innovative, and they can do it, they can handle it, and I think we're learning that can be done. Don't panic, look at it, make some reasonable things, and adjust them when you find out, oh, that's causing all sorts of problems, or gee, we don't have to be that strict. It depends. You're going to learn from this, if nothing else, how to handle what happens when we have viruses all the time. We have the flu thing coming along. We have a couple of them coming around, and whatever the bugs can transmit, And watch out. We have bats here in New Hampshire too, where they may be transmitting something.
Yeah, I remember as a kid, you'd go to school, and then in September, all the kids would share their various bugs and bring them home to the rest of the family. So, we all got sick in September with some kind of bug, and eventually you get immunity, over time. But as a fact of growing up, I mean, we don't live in a sterile world, and I think the issue here is not trying to achieve this endless restriction and look at something reasonable in view of the data. I mean, my big concern is the Nashua aldermen who put an unlimited restriction on the folks of Nashua that you got to wear a mask if you go into a building, a penalty of $1,000 fine with no time limit on this. It doesn't say, well, it's going to expire in 3 months and maybe we'll renew it. No, it's now indefinite until, Mother May I, Madam Alderman, will you please let me walk into a bank with my friends and not wear a mask with my peers who are of, say, modest age and no one over 60. So I think the aldermen need to wake up a little bit and stop overreacting to the current data that shows who the vulnerable population is and remove the restrictions from the non-vulnerable population.
Mm. One other thing I'd like to bring up on this, I think it shows it shows how innovative our industry is. When they wanted to have a vaccine quickly, they're doing things now that they haven't done before. They were very systematic because of past history or whatever, and they were doing it just serially. This time, they started doing things in parallel. They were producing different vaccines before they were tested and just storing them. They are holding them, and they could, if they prove to be good, they'll be ready for use. Part of the thing is that most people don't need. The cost of our medication is more in developing and testing the thing than it is in making it. Making it probably is the cheapest thing in the whole process. But I think they're learning that it's cheap enough that I can move in parallel. And if I have to throw it out, I'll throw it out. And that's, I think, is waking people up. And I think they might look at developing drugs more reasonably that way, too.
Yeah, I think in this case, there's a big race among the private companies now to develop the vaccines. It's not the National Institutes of Health or the CDC that's controlling the flow of research. I think the president, to his credit, said, look, anybody who can come up with something, you're going to get some funding for this. And I think somebody has a successful vaccine, and there's a few that are going to phase three trials next month. And I know they're scaling up, as you point out, Carl. They're having the facility in place to reproduce the vaccine should it be proven safe and effective. So I'm kind of more of a free enterprise kind of guy. Let's have a lot of people compete for this business, because I think it's going to be a big success for whoever comes out first.
And some of the companies are joining up with other companies too, which is a good thing too. When you have a couple of different people looking at it different ways, you develop a better product.
Yeah. So what do you think is going to happen with our taxes, Carl, here in the city of Nashua? I know the aldermen have ambitious plans for.
I think the one that we just paid, or have to pay by the end of the month, we are going to have a higher number because they just don't have the income. But I think, and I wrote an article on this, is we got to watch what we're spending. And I think that they're aware of it here in Nashua. There's things that they can maybe skip. Two of the things that I recommended in my article was that they not spend the money on building a new school right now. Maybe they can hold off a year or two, or maybe they can look at reducing it by expanding some of the smaller schools to handle the people that we're going to have to move from Elm Street School, or the new system that they want to implement in the school, which is a more socialized approach to teaching the kids. I saw an article in the Union Leader yesterday, in the editorial, called "Don't Dumb It Down." Apparently, they're interested in changing some of the process of education in Manchester, too. I haven't kept up on the details of it, but they brought out the fact that we still have to have challenging our kids. The kids are best trained if they're challenged, pushed a little bit, because that's what they're going to have to handle when they get out of school, with on a job and everything. There you'll find out that the people that are working hard and doing things innovatively are the ones that succeed. And you don't want to dumb down the school. And the proposal for Nashua was to increase the spending by, I don't know how many millions of dollars. The new system, I think, had something like $5 million if you consider all the benefits of hiring more people that have not a educational background, but a social background of how to handle emotional things and how to handle, you want to have people in school who are good, attentive students and want to learn, but you don't have to focus too overly on that. You still have to make sure they're at the proper reading level. How many of our kids are not at above 9th grade reading ability when they graduate high school? Some of those numbers are pretty bad. And the same thing with math.
Yeah, I was going to say, I think, isn't the role of the parents to handle the social issues with the kids, and the job of the teachers to handle the 3 R's, reading, writing, arithmetic, the basics of education? And they have their parents, assist them with the homework. And, I would think that'd be the most efficient use of the teaching system, which is to, pound the fundamental skill set that the kids would need to have to be productive in the real world once they graduate.
They have to
understand how to compose a sentence, to make a calculation, to balance a checkbook.
Now, I think we have to focus on the academic area. And if you want to make some other kinds of adjustment, don't take it away from the educational focus. That's what they're there for. You may have to look at a different way of doing your educational vote. I understand there's a wide variety of students there, and if you try to, one way fits all, I don't think that's good for the kids. You have to have different times with different people, and that's why a lot of the charter schools are succeeding, because the kids there are ones that are adaptable to their method of teaching. And the variety that we have, we're fortunate for that too, because there are several different types of charter schools here in Nashua alone or in the state. And if your child is more responsive to a certain approach, take advantage of it.
Yeah, I would think so. I remember when I was a kid, there'd be honors classes in high school for the kids who were, better prepared and wanted more of a challenge. And there's remedial classes for the kids who needed extra help and extra tutoring. But it wasn't, the standards were lowered to the least common denominator, so everybody, passed. You got a grade that was honest. And if you got a grade that was not to your parents' liking, well, there was some incentive to shape up a little bit. Stop goofing off in class.
Well, I know our school that I graduated from had a lot. It was a large town, and the graduating class was like 750 people. And this was the time the country was growing. People were coming home from the war, raising families, and houses were going up left and right. But they were able to sort of separate the kids in like 4 different levels. And that didn't mean it was demeaning. You could go from one level to another if you showed that you had the capability of handling it. But, and now you're complicated with different languages in school. The kids come up with one of 100 different types of languages or whatever it is. That's kind of...
But I think the evidence is kids at a young age before puberty can pick up languages really fast and really
That's
good.
right.
They should be taught English to be productive. Well, Carl, I think we're going to wrap it up, but I'd like to thank you very much for your insights into education and the economy of Nashua. And for Carl Seidel, I'm Bill Ohm, your host for The People's View. Take care.
Thank you, Bill.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.